Well, today from Breastlink over here in Laguna Hills, we have a wonderful guest with us today, a breast cancer survivor. And I'd like to welcome Mila Evanovich.
Thank
Nice
you.
to
Thank you
meet
for having
you.
me.
And tell me about yourself and how long ago did you go through this process and how was it first discovered?
Um, I was diagnosed in February of 2014
Okay.
with invasive ductal carcinoma. Scary diagnosis.
Hmm.
I have a strong family history of breast cancer.
Okay.
However, I did have the genetic testing done at Hoag Hospital, and interestingly enough, I did not carry the BRCA1 and 2 gene. I had a panel test of at that time of they isolate 6 genes
Hmm.
out of 22,000, and those are basically your breast, your prostate cancer genes. Mine came back negative.
Okay.
So that was incredibly promising.
Yeah,
Yes.
exactly.
Yes.
So did it surprise you then
It
when you
surprised
got
me.
this?
It
Yeah.
was an enormous surprise. But my main focus was that we have 2 young daughters,
Hmm.
and at the time of diagnosis, they were 19 and 21. So for us, or for me, it was very important to get the genetic testing done,
Hmm.
because that would also indicate, it was a strong likelihood that one of my 2 daughters would carry
Right.
that gene. Um, so it was a big celebration when it came out negative. And
Yeah.
it also helped guide me into which direction I was going to go to have, which type of breast surgery I would have. So I
Okay.
ended up having the lumpectomy,
Hmm.
and actually they operated on both breasts.
Okay.
I had the lumpectomy, and it was sort of like a mini mastectomy. And I wanted to make my decision. I wanted to make a concrete decision based on the genetic testing and the input of my group of doctors, and I didn't want to make the decision out of fear.
Okay. So you kind of weighed the fact that your genetic testing showed that you did not carry this particular gene.
Correct.
However,
Correct.
you ended up getting this cancer. So you
Yes.
kind of looked at the two,
Yes.
and with the doctors, you were able to determine which was the best course.
Yes. Look very carefully at this cancer,
Hmm.
and look very carefully at family history, look very carefully at my risk factors, and tried to make the best decision for myself, for my family, for my daughters. And I think I did my homework
Hmm.
exceptionally
Yeah.
well.
So how did you find Breastlink?
Interestingly enough, I didn't know anything about Breastlink, and I went to 2 other places, and a good friend of mine who was in the medical profession knew that I was a little frustrated and felt a little unfulfilled
Hmm.
with the direction I was going,
Right.
and she had asked me to talk to a friend of hers who was a medical professional who was in the midst of breast cancer, and I talked to her. She became my sister in cancer, and she led me to Dr. Nimmi Kapoor, my brilliant surgical
Hmm.
oncologist.
Yeah, yeah, definitely. So once you got there, they have sort of this approach where everything kind of is done in house. I know they have people you can talk to there, and they have their program there that you can actually talk to volunteers that have gone through breast cancer before.
Mm-hmm.
So
Yes.
it's very cohesive in
Yes,
the amount of
exactly.
help that they give you there, right?
Exactly. It's an incredible organization. They're extraordinary in what they do.
Hmm.
Dr. Link, the oncologist, he's phenomenal. Dr. Link has written a #1 bestseller about breast cancer, and I have purchased about 7 copies of his book and passed it on to friends and people, friends of friends going through cancer, and said, before you do anything, read this book,
Hmm.
because there's just a robust amount of information in Dr. Link's book. Dr. Gown is my plastic surgeon, another brilliant surgeon, and I can't tell you how pleased I am, and they're very much in the forefront of breast
Hmm.
cancer today. Orange County, LA, and San Diego County we're very much leading the pack in breast cancer today. And the tests that I had in this area, the newest panel of genetic testing is done in Aliso Viejo. My mammoprint test, which I had done after my surgery, there's one lab in the country, and it's that does this mammoprint, and it's in Irvine. And then I had a very new and recent test called a breast cancer index test, and that's out of La Jolla.
Yeah, so everything's in this area.
Yes, exactly.
So right now, what is your prognosis? And are you going there for follow-up appointments every so often?
That's a very good question. I feel that I am recovered.
Yeah.
I feel that I am cancer-free, hopefully for the rest of my life. But of course, none of us really know. I feel I am cured. I do go for follow-up. I go every few months for follow-up and see the various doctors, all at Breastlink. And I sort of changed the direction of my life. I'd been a vegetarian for 47 years. I thought I knew all the answers. I thought I was eating really well. But when I sat and after talking with some of my doctors, and I ask a lot of questions. I'm a writer, and one of the questions that I asked through treatment was, what can I do? What can I do to not have this cancer come back? And one of the doctors had said to me, say goodbye to wheat. And
really?
I was astounded with that information. So I did a little bit more research, and so essentially now I have said goodbye to wheat, and it wasn't a happy decision for me. But now I essentially eat fruits, vegetables, and a little quinoa and salmon, and really watch, what I take in. And my motto now is lean and green. And exercise played an enormous role in my recovery. I spin, and all through cancer treatment, I would cycle 60 miles a week. And I saw some people struggling through treatment, and my advice would be to exercise more. It's healthy. The positivity is important, the nutrition is important, and be around positive people. Step away from any toxic environment you could be in. You need a nice and strong support system.
Well, it sounds like you have that.
I think I have a phenomenal support system. I'm very lucky.
Well, it's great meeting you, and it's wonderful that how everything has turned out for you, and hopefully it remains that way.
Thank you for having me.
So great to have you here. And Breastlink over here in Laguna Hills, our number is 949-770-7097, and you can see how they helped Mila. Above everything else, it is that sort of all-in-one program that they have there. Obviously, they have the breast surgeons, but they have reconstruction, plastic surgery. They have volunteer program, oncology. Everything is all right there, and that's what makes it great.
It's phenomenal.
Yeah. Nice to meet you.
Thank you again.
All right. We'll be right back. We'll get you.
Okay.